Hi, so I'm Dr. Sarah again, here with Dr. Cynthia Diep. And tell me, Dr. Diep, what do you do for patients who have active TMJ pain? What should they do throughout the day or some exercises throughout the day? How do you approach that?
Yeah, that is a very good question because a lot of time patients come into our TMJ clinic and present themselves with physical condition, but we always have to think that in chronic pain, to treat the chronic pain, we have to address the physical condition and the lifestyle and the sleep. So my approach is I will show them how to do myofascial pain protocol, which we're going to review soon. Plus, I always ask them, now you have pain, you have to take off all the hard food in your daily life.
Okay.
What is hard food? People eat peanuts, almond crunch, even carrots, even salad can crunch and aggravate the problem. And they say, oh, but I love that. I say, okay, you only have to stop until your condition improves. Just like you torn your ligament and you don't continue running, right? You have to rest your ankle. So that's number one, change your diet. Number two, think about your sleep. Do you sleep enough? If you don't sleep enough, the pain will be piling on.
Yeah.
And then your habit of sitting at the desk and then try to do mindfulness breathing. Okay, so now let's get to the physical part of the pain. So let's say patient have a lot of headache, pain radiate up, or in the middle of the day, they feel really tight. So typical patient that I have usually are people at the desk, like lawyer, pharmacists, PhD student, dentists, all of those that hunch over and, get really tension. And then they forget and they clench their teeth inadvertently. So what we do is we have end rest, end stress, and chin tuck. That's three things. So let's review end rest. When we are not eating, our back teeth should not touch. If our back teeth touch, we can clench. But if our back teeth cannot touch, by putting the tongue behind the two front teeth, like you say Boston, and you end with an N, and you put the tongue there and you close. Your back teeth cannot touch. And when it cannot touch, and if you keep the tongue there, you can go on with whatever you're doing, but not clenching.
Okay. So this is your
rest.
Resting position throughout the day. You should, anytime you're thinking about it or not thinking about it, you can check in, see where is your tongue resting, and it should be resting behind the front teeth on the top of the palate. And you can find that by making an N sound. Okay.
So that's end rest and end stress. Sometime every 2 hours, you can put an alarm and make sure you stretch out your jaw actively. So it's still an N, but you open as wide as you can. When do I do it? I can do it when I was driving on the freeway and it get bored. And people are passing me by. Whatever.
Okay.
Weird.
And having that's there, it kind of protects you from overdoing it too.
Yes, exactly.
So that you're not going to cause any damage or cause any harm. So you could think of that as kind of an inherent protection.
Yes. So do it as often or every 2 hours, whatever.
Okay.
The third thing that's common is I see people at the bus stop standing, waiting, and they're looking at the computer or the iPhone, and the neck is bent right at the C8, C7 area.
Yeah.
And that's when all this muscle is tight. And when you have tightness here and tightness here, it will pull on your TMJ here, and then you can have TMJ pain.
Definitely.
So what we do is, even when we sit at the computer and whatever, don't do it like this, but sit straight up and put chin tuck. So look at me in the side. Let's say if I'm doing this, and if I put my finger nose onto my nose like this and move my jaw away from the nose, you see, and make myself a double chin. You see that? Then my neck automatically stay on top of my spine.
Mm-hmm.
Okay, so it doesn't matter where you are, you just you automatically and you double chin yourself, and then that's the position where your neck should be.
Okay.
So end rest, end stress, chin tuck.
Okay.
And if you feel tension, you can always have some hot compress too.
Okay, great. Okay, yeah, I think that's really important to keep that alignment when you're working so that you're not adding undue strain to the neck and jaw.
Yeah.
Awesome. Thank you so much.
Yes.